So many of the individuals that I have taken care of have come to me having been rejected, told there's nothing else that can be done, that it's all in their head, which it is. And it has been a problem that they have cried over. I've had them weep in my office saying, it's not my child. They went to bed, my child, and they got up, and somebody stole my child. What has happened to my child? I've heard this story over and over again. Let me tell you the story of Maya. Maya was brought to see me when I was practicing in another state. This was a beautiful little girl. She was about 6 years old, loved nothing more than playing with her kitten, was a good student, very bright. Went to bed on Friday night, kissed goodnight, got up the next morning screaming. Would not separate from her parents for any reason. Would not go to the bathroom alone, would not sleep alone, nothing. She stopped eating. Ate a few things on Saturday, Sunday ate even fewer, and by Monday morning had stopped swallowing her own saliva. She was lining things up, washing her hands repeatedly. They had already started to get raw when she went to the pediatrician's office. By the time she got to see me on Tuesday, she not only had a facial tic where her face would curl up, but her hands had started to move and do odd patterns. I started her on treatment. She walked in the door, I knew what she had. And I started her on treatment. And within about 6 weeks, she was able to go to school. She was able to eat. She was able to be almost completely herself. We were still working on a few of the obsessions, but she did much, much better. Now, this was before we had the Cunningham panel, and it was an immediate case where it was recognized as soon as it happened. And we can make huge differences when that occurs, which I'm hoping is how this is going to open up the world for catching these kids so much sooner. But I have another story. A mother brought me her son not very long ago, in April actually, and said, help us. Same story, child changed, beautiful little boy, smart, and when he was 2, he started getting a string of ear infections, and he changed. He became obsessive, he became light sensitive, he had trouble remembering things, he had trouble focusing, he had extreme problems from the point of coordination and social interaction. He was very isolating in a lot of ways. Took a look at this young man and thought, there it is. He had been to see numerous doctors, occupational therapists, psychologists, pediatricians. And he had been diagnosed with attention deficit and autism. Pretty common diagnoses to see with these kids. I've even seen some diagnosed with childhood schizophrenia. So, we started treatment. And I want you to know that this young man is a star pupil. For having had this for so many years, he has done extremely well. He was on an IEP, could not read, could struggle with Dr. Seuss books. He just finished reading The Sorcerer's Stone, the Harry Potter first novel. Adam, can you come talk to me? This is Adam, and Adam has now a straight A average in school. They are pulling his IEP back to just checking on him once in a while, and he was doing that every day. All right, thank you, Adam. So again, I want to thank you for the opportunity to share a few stories and for having the opportunity to help more kids.